very exciting to announce a new product too from Microbiome Labs. Last month, we did a webinar educational presentation about stool testing, and fascinating. And they have wonderful tests at Microbiome Labs, as well as, of course, all the probiotics and Megaspore and all that. Prior to that, we did a product presentation and webinar about the vaginal microbiome, which was fascinating, and their test for the vaginal microbiome. And Alicia told us that there was a new product coming out to help balance the vaginal microbiome, and that's what this is. Most importantly, it's free education. So stay if you want to hear about the product at the end. Great. If not, no problem. We do have a special discount for you, but we are going to be learning about probiotics and how our vaginal microbiome is so important, not just for urogynecological health, but also our overall body health. And with that, I'm going to hit it over to Alicia and say welcome. She is a registered dietitian. She is one of the very few specially carefully handpicked educators from Microbiome Labs. She teaches courses about things like SIBO as well, and just has a really, really fine way of presenting. So I'm going to wrap up my part and let her take over. Thanks for being here. Happy.
Yes, thank you so much. And thanks so much, everyone, for joining. I'm really excited to talk about this today, mostly because I think it's a topic that we really don't talk enough about.
100%.
Women's health in general, but definitely the vaginal microbiome. And the thing that is so critical, if you look at the research and you look at how much the vaginal microbiome influences women's health, is, we talk about the gut, gut microbiome and how important it is to our overall health and wellness. And for women, I almost see the parallel of the vaginal microbiome being such a hub of health for women's specific health conditions. And so I hope today you can see that as well, and you might agree when we discuss these things. So just for time, this is what I'm going to tell you, but we'll just talk about these various things, and I'll just move on. So on that note of being underfunded, so really up until recently, the last 10 years or so, women's health has really not been looked at. And when you look at the literature, women are vastly underrepresented, and there's a very strong bias towards men. And the assumption is that if you study a certain condition or a certain intervention in men, that those results can then be extrapolated to women. And that's just not the case, because women are more complicated. We have more hormonal shifts that happen throughout the month, through our menstrual cycle. We also, due to the hormonal changes of menopause and puberty and pre-puberty, that affects our physiology as well. And so you can't extrapolate that. And so only 1% of healthcare investment for women goes towards diseases other than cancer. So it's a very small percentage. And I think we can do better. And that's part of, I think, this resurgence of women's health. And I know, Shivan, you're running kind of your own educational event around menopause currently. And
Yes.
I think that those are we need to talk about women's health. We need to, because it hasn't been discussed in the literature enough. So I'm going to do a real quick recap about what we discussed back in October, as Shivan was mentioning, just for those of you, if you've slept since then, but also if you didn't have a chance to tune in to that conversation in October, you can kind of know where we're coming from. So the vaginal microbiome should have predominantly lactobacillus species. When we talk about the gut, we talk about the gut having lots of diversity, lots of different types of species. Well, we don't want that in the vaginal microbiome. We want to have a really low bacterial diversity that's predominantly lactobacilli. And the reason is because these lactobacilli help to keep the environment in such a way that it helps to prevent the influx of pathogens. So part of what lactobacilli do is they help to produce lactic acid, which keeps the pH nice and acidic. And they also produce various antimicrobial byproducts to help with the prevention of these pathogens adhering to the epithelium. So we want to have lots of lactobacilli. And the most dominant lactobacilli in the vaginal tract are L. crispus, L. gastri, L. jensenii, and Lactobacillus einers. Now, this ecosystem can be disrupted through various factors. So our diet can play an important role, hormonal changes like estrogen specifically, sexual activity, hygiene practices, medications like antibiotics, and then stress. So how many of you know somebody who is affected by one of these particular factors, dysbiosis risk factors? I think all of us probably have at least one. And so we know that there can be a lot of environmental influence in the vaginal microbiome that could potentially disrupt this delicate ecosystem. So this is what a healthy vaginal environment looks like. So if we can see up here, if we have a lot of lactobacilli, they make these protective antimicrobial peptides like bacteriocins and hydrogen peroxide that inhibit pathogens. They also produce that lactic acid to keep the pH nice and balanced. The other key piece is estrogen. So estrogen is what allows for that glycogen or that glucose, those sugars, to be at high enough levels in the vaginal tract that these bacteria can feed off of it. So lactobacilli prefer glycogen as their fuel source. That's what they like to eat. And if we have an adequate amount of estrogen circulating in our body, then we can have an adequate level of glycogen that supports the growth of these lactobacilli. Now, if we have a situation, whether it be menopause, pre-puberty, hysterectomies, postpartum, where those estrogen levels are really low, that estrogen level can fall, and that can decrease that glycogen, and then that fuel source is basically lost. And so lactobacilli then can decrease. If we don't have enough lactobacilli, then we don't have enough of these protective byproducts that can allow more pathogens to come in, and then that can lead to some of these adverse outcomes, whether it be adverse pregnancy outcomes, bacterial vaginosis, that type of thing. So this is what we don't want. And lactobacilli really are the gatekeepers. They are our guardians of the galaxy, so to speak. They help to keep things nice and balanced. So what does vaginal dysbiosis lead to? You could be vaginal bacterial vaginosis, urinary tract infections, yeast infections. These are probably the top three things that most people are going to encounter if they have vaginal dysbiosis. But it could lead to other things. Like I said, poor pregnancy outcomes, premature birth, endometriosis, cervical cancer, pelvic inflammatory disease, fertility issues, STDs, and gynecological cancers and toxic shock syndrome. Now, again, these are going to be much more extreme areas of the spectrum, but can definitely be as a result of that vaginal dysbiosis. Now, as Shivan mentioned, we do offer a test. It's the Vaginal Health Kit. And what we're looking at in that test is we're looking at what's called the community state type. When we're looking at a woman and we're looking at their vaginal health, those environments can be classified into one of 5 different community state types. So state type 1 is Lactobacillus crispatus dominant. It's considered the healthiest and has the lowest acidity, lowest pH, or I'm sorry, highest acidity, lowest pH, and it's the most stable. So we really want to have a microbiome that is predominantly Lactobacillus crispatus if possible. However, L-gasseri can be very helpful as well. It's not as common, but it can be healthy. Lactobacillus iners is a little bit, it's kind of neutral. It can kind of go either way. It can either go towards a healthy environment, depending on what other microbes are there, but it can also be more dysbiotic, depending on if you have pathogens that are allowed to come in. It's not quite as stable, so it has the door sort of cracked open, so to speak. So it's not completely open, but it's cracked, and so it's very easy for these pathogens to come in. State type 4 is going to be when you don't have any lactobacilli, and that's going to have the highest risk of things like BV or yeast infections, those miscarriages and endometriosis. And so we want to try to support that type of community state type as much as possible. And then state type 5, again, not as common, but it's considered pretty healthy. Now, the reason why, or one of the things we also consider when we're talking about the gut and the gut vaginal microbiome crosstalk is that because of the proximity between the anal opening, the vaginal opening, and then also the urethra, is that the health of someone's microbiome in their gut plays a big role in how healthy their vaginal microbiome can be. So those that have dysbiosis of their gut tend to have dysbiosis of their vaginal tract. Those who have healthy, high levels of lactobacilli in their gut tend to have higher lactobacilli levels in their vaginal tract, and that is due to that close proximity. So when feces are shed, there can be that cross-contamination and that translocation of those bacteria. So if someone has gut dysbiosis, that can beget vaginal dysbiosis. But it can also work the other way too. Now, when we talk about pregnancy, and the reason I'm bringing this up is because one of our products that I'll talk about has some strains in it that are very specific for helping the maternal fetal microbiome and helping in pregnancy, which I think is very unique because there's not a lot of products out there other than prenatals that are really marketed as being a pregnancy supportive product. And the reason why it's so important to think about pregnancy and women's health in pregnancy is because that can really dictate the health of the baby and can inform the infant microbiome. It can inform the infant immune system. We know that the maternal gut microbiome plays a role in the composition of the breast milk. And that when a mom or a woman has a lot of dysbiosis and lots of inflammation in her gut during gestation, that can then lead to some of these immunological outcomes in the baby. And part of that is because of the inflammation that comes from that dysbiosis that can disrupt the T regulatory cells, and it can lead to an inappropriate immune response in the offspring. Now, this is just an image that shows how the lactobacilli and the health of the vaginal tract can actually influence miscarriage and pregnancy loss, which I know can be a very sensitive topic for women, and can be a very emotional topic. And I think for anyone who has gone through a miscarriage or has had a pregnancy loss, that there can be a lot of shame and a lot of guilt and a lot of self-blame. And that is something that I think is so sad. And I think one of the things that if we can empower women with knowledge and practitioners and patients with knowledge that there might be something, the worst thing you want to hear is from a doctor saying, well, I don't know. We don't know why you miscarried. And especially if someone has had recurrent miscarriages, that's very, very difficult. And so I think to know that the vaginal microbiome can play a big role in that and can influence the health and the outcome, I think that's something that we can kind of hold on to know that there may be a stone that we can turn over. There may be something that we can do and something that we can have control over to maybe change some of those outcomes. A lot of that has to do with, again, lactobacilli being those protective gatekeepers. If someone does not have enough lactobacilli that allows for those pathogens to come into the vaginal tract, they can ascend and go up through and into the uterus, and it can start to affect uterine contractions and the membrane remodeling, and that can then lead to a miscarriage or pregnancy loss. So what do we do about that? What can we possibly how can we influence this? How can we influence the health of a woman and affect the vaginal microbiome? And also looking at testing. So again, I'm not going to go into this in detail because there's a webinar that we did back in October around this test, but it is a way that you can see if someone has a community state type, like a type 3 or 4, that might need some intervention and could be driving some of that particular woman's symptomatology or some of her disease state. Now, probiotics in the vaginal environment. So you might wonder, okay, so you take a probiotic orally, but how does that affect the vaginal environment? And we're going to talk about that a little bit. But we know through emerging research that probiotics have actually a pretty big role to play, and they can make an influence on the health of the vaginal microbiome. And so I'm going to show you a little bit of research here through some of the specific strains that have some science behind them to support colonization of lactobacilli and also help with symptoms that these women might be experiencing. So our two products that we have are pregnancy support and vaginal balance. Vaginal balance is a 4-in-1 support, so it helps with urinary tract, vaginal tract, immune health, and also digestion. And then pregnancy support is really geared for moms and infants and helping with some of those infant outcomes, as well as supporting the vaginal health of the mom. So let's talk about Astarte. Astarte is in both products. It is a blend of 4 different lactobacilli strains. An L. crispatus, which remember is one of the healthiest lactobacilli that we really want to have in robust numbers in the vaginal microbiome. Lactobacillus jenseni, gasseri, and rhamnosus. And these strains are very resilient. They're very stable during digestion because they have some mechanisms that help protect them through that digestive process. But what they have been shown to do is to really improve the balance of the microbiome within the vaginal tract, and also helps with maintaining those lactobacilli species and helping with digestive and vaginal complaints. So this was a study that was done in BV, bacterial vaginosis, and in these groups, you had half of the women who received the placebo, and then half of the women received the probiotics. Everybody received metronidazole. So everybody received the standard of care for BV, which is metronidazole. And then they looked at basically the outcomes of how many women still qualified for a diagnosis of BV, and then how many of them had these different symptoms. And what they found was that in the probiotic group, 100% of women did not have BV anymore, versus about 64% in the standard of care group. So those women who were on the standard of care actually did better if they had a probiotic on board versus if they were just taking the antibiotic. There was also a 200% reduction in their AMSL score. AMSL score, if you're not familiar with that, it's 4 different criteria that are used to diagnose BV, and it has to do with their pH levels, the different cell, what they're called clue cells. There's a few different things that they look at. So there's a 200% reduction in the AMSL score. And then there was also a significant reduction in discharge, vaginal discharge and odor. In this study, with the 4 blend of the Astarte, this was looking at women who had herpes viral infections. And so and these were pregnant women. And so you had some who received the probiotic, some who just received the standard of care, and then you had the control group, which was just healthy pregnant women that didn't have herpes viral infection. And herpes virus infection was used as an outcome measure of, as an example of just bacterial microbiome dysbiosis in those women. So they're looking at candida as well as discomfort, and they also were looking at a few other measures. And in this group, what they found was those that were receiving the probiotics, there was a 200% increase in their lactobacilli. There was a 58% decrease in those who had a pH that was above that 4.5. So 58% fewer women had the more alkaline or that higher pH, which means that they had better, more healthy ranges of their pH. A 67% reduction in vaginal itching. There was a production of hydrogen peroxide. There was a decrease in incidence of pathogens. They looked at several different pathogens like strep and E. coli, and there was a significant decrease in those. There was also an improvement in placental insufficiency. So there was a decrease in that insufficiency. And there was also a decrease in preeclampsia, which is pretty interesting for those women who are pregnant to see those kinds of outcomes, because preeclampsia, if you've talked to any OBGYN, is sort of the question mark in women's health and pregnancy. People don't really know what to do about it or why it's there and what causes it. So it was interesting to see that there was that significant of an improvement in that particular realm. And then also another mechanism of how these strains were making all these benefits was by lowering that pH through that lactic acid production. So that's Astarte. That's in both products. So you get that vaginal support in both products. Now, LA5 is more specific to Candida. So this was a crossover study. So you had half of the group start out with a placebo.
Alicia, hold on. I'm sorry to break your flow. Preeclampsia, doesn't that also can't that really hurt the baby and the mommy?
Yes, preeclampsia is a very serious pregnancy complication that can affect the mom and the baby if it gets to be too severe. So
That's amazing. I just wanted to have this moment of wow, and compared to the metronidazole and everything.
Yeah.
Wow, just wow. Bye. Keep going.
No worries. Now I find the study actually kind of funny because the women started as their own control. So half of the women started out with a placebo, half of them started out with the probiotic, and they were looking at candida and symptoms. They started out, you'll see the N is pretty low, N of 13. They started out with a lot more women, but what happened was a lot of the women who started out with the probiotic just refused to go to the placebo because they were feeling so good. So they had to discount they had to exclude all of those women because they refused to go to the probiotic or to the placebo group. So they actually ended up with a smaller cohort than what they started with. But I think it's kind of a good reason because the women were feeling so much better on the probiotic drink than those who started on the placebo. And what they found in this group was that there was a 30% reduction in vaginal discharge, a 66% reduction in burning, itching, and then dysuria, which is pain with urination. So there was an improvement there in those yeast symptoms in those women. And then in this one, this was also looking at how do these probiotics serve as an adjunct to standard of care. So I think the important thing to note is that if you are a patient or a practitioner, and if you feel like it's appropriate for that patient, or if your provider has put you on an antibiotic or an antifungal, these probiotics can serve as an adjunct therapy. So it's not an either or. It's something that you can use alongside and still get clinical benefit and be protective. So in this group, they were looking at the group that either received 1 dose of fluconazole and then a placebo, or they received the 30 days of a probiotic and they did not receive the fluconazole, which is an antifungal prescription. And what they were looking to see is, how does that compare? How do the probiotics alone versus the antifungal alone affect candida and fungal outcomes? So they were looking at candida overgrowth, and they were also looking at these different symptoms. And what they found was that there was actually a similar outcome. So those that were just receiving the probiotic versus those that were just receiving the antifungal, the results were really not that different within the study timeframe. There wasn't a statistical significant difference. And there was still reduction in both groups, but in the probiotic alone, there was an 85% reduction in yeast infections and a 74% reduction in candida colonizations as a result of this probiotic. All right, so that's in the Astarte, which is in both. LA5, which is in the vaginal balance probiotic, and then LGG. This is going to be in our pregnancy support. Now, LGG is not really only a women's health strain. It's from healthy humans. It supports many different areas like the gut and the immune system, but it's extensively studied. It is the world's most documented probiotic strain. It has over 1,900 scientific publications and over 250 clinical studies. So there is a lot of research around LGG. And the reason why we've included this in our pregnancy support product is really because of the outcomes that it has shown with the offspring. So there was a 3-part study that was done where the moms took either there's a placebo group and then there was an intervention group. There was about a month or so before expected delivery, the moms took either a placebo or a probiotic. Then they gave birth to these babies, and half the moms continued with the LGG, but then half of the infants were given LGG. And this was done for 6 months, and then they stopped. So it was a month before delivery, and then 6 months after there was supplementation. Then 2 years later, 4 years later, and 7 years later, they followed up with these babies, and they said, okay, what percentage of these babies compared to placebo had red and scaly skin? In the groups that received the probiotics, there was a 50% reduction at 2 years old, 43% reduction at 4, and 35% reduction. So those that were receiving the probiotics way back 7 years ago in pregnancy and for 6 months post had significantly less instances of red and scaly skin in the offspring up to 7 years later, which I think is fascinating. And it just goes to show that what we do and what a mom does in pregnancy and immediately in that postpartum period can really make an impact on long-term years later, what's happening with the immune system in the offspring. So I think this study really is interesting in showing that. And what we've done is the exact dose that was used in this study for these outcomes is what we're using in the probiotics. So that's one of the unique things about these, is that we have found a way to formulate them so that what the clinical study dose has been used is what you're getting in the pregnancy support and the vaginal balance support products. Now, Istulose is a bifido. It's not a lactobacilli strain. Everything else we've talked about has been in the lactobacilli family. This is a bifido strain, and this is really geared, again, to the baby and the infant, since bifido strains are really important for babies in that first 1,000 days. That's what's predominantly makes up their microbiome. And so what this study looked at was, again, it was moms and babies, and the moms took it for 2 to 4 weeks before delivery, so about a month. And then they took it for 28 days, and then they stopped, and there was a 2-week, what they call a washout. So they didn't take anything in those 2 weeks. And they looked at the babies. There was an infant group where the babies took the probiotics directly. And so they were looking to see, is there a difference in, the mom's taking it versus the baby? And they looked at the fecal sampling to see what percentage of these babies then had this probiotic that showed up in their stool. So 30% of infants had the probiotic, but in those where the moms were given the probiotic and was taking it and it was getting to the baby, there was actually a greater increase in butyrate levels, which is important because butyrate is a very important short-chain fatty acid. You've probably heard about butyrate through various Shivan webinars, but what butyrate does is it helps to inform and mature the infant gut epithelium. So it helps with that closure and the health of that gut epithelium, and then also the immune system. So it informs the immune and educates the immune system, and it also helps with the gut. What was interesting is that you would expect typically that when you stop a probiotic or you stop taking something, that that particular level will decrease. However, what they found is that in those babies who had this establishment of this bifido strain, they saw an increase in that strain after the washout, which means that what happens is with the strain is it actually took up it took up shop. It essentially pitched a tent, and it's now part of that established gut microbiome. It's called engraftment. And so that's key, because what we know then is that this particular strain may become and assimilate as part of that infant's microbiome and continue to help with that butyrate production and that informing of the immune system and the gut epithelium. So these are the labels of these two products. Again, both of them are going to contain the Astarte blend, which is the blend that helps with just the overall health of the vaginal microbiome. Vaginal Balance does have the cranberry for the UTI support, as well as LA5 for that yeast support. So we think about the Vaginal Balance as being sort of that woman's one-a-day multi for vaginal health, very comprehensive. And then pregnancy support has the Astarte as well as the LGG for the baby, and the Istulose for the baby for that immune system and the gut. So who would this be for? If you or your patients or you yourself have struggled with a history of antibiotic use, maybe for recurrent UTIs, Vaginal Balance would be for you. If someone has recurrent vaginal yeast infections, recurrent UTIs, if you're preparing for preconception, trying to conceive and wanting to just strengthen the resilience of your microbiome, fertility challenges, and then postmenopausal women who are struggling with that vaginal and urinary infections or yeast infections, especially with that decrease in estrogen. For pregnancy support, it would be anyone who's pregnant, definitely, especially in later parts of pregnancy. That's what the studies have been done with. Also, if you're breastfeeding or pumping, we definitely want to support. And again, there's benefit in the moms taking it pre-delivery and then also post-delivery. Anyone wanting to support their health, vaginal health during pregnancy, and then especially if there's a family history of that red and scaly skin. So essentially, to sum it all up, I hope you see and believe, and maybe you knew before or had an idea before, but I hope that this conversation maybe sparks your interest or sparks the conversation with your doctor, or maybe if you're a practitioner, to dig into this, because vaginal microbiome health is so critical to women's health in general. I mean, pretty much any women's health condition, you can focus it right back to the vaginal microbiome, and appropriate assessment, appropriate interventions, looking at what can be a specific targeted therapy, especially probiotics that can really optimize vaginal health, is, I think, a very, very exciting area to be in. And I know for women, if you yourself, or if you're a practitioner, if you struggle with women's health challenges, if you work with patients who struggle with women's health challenges, you know that it is not just the physical symptoms that these women are experiencing. It's also the emotional. There's frustration, there's guilt, there's shame, there's loss of hope. There's so much that goes into it emotionally. And so if we can do things to not only help the physical symptoms, but also the emotional and the well-being of these women, I think that's a wave that I want to ride and I want to be a part of. So I hope today helps to plant some of those seeds. And so, yeah, that's what I have for you guys. Thanks so much for your time.
That was amazing. That was amazing. And so applause, everybody. Let's throw some love into the chat for Alicia. That was really beautiful. Thank you so much. And thank you at Microbiome Labs for this. This is so powerful.
Yeah, I think it is. We're excited about it.
Yeah, you should be. Those results are astonishing. Really. That's amazing. Everyone's results are going to vary, of course. And this isn't medical advice, but this is definitely a tool for you to evaluate.
Yeah.
And figure out, if it's a fit for you.
Okay. These will not cure. These will not prevent. These will not, we're not saying that this should be a replacement for any of your therapies. it can be an adjunct, it can be a support, but it's not, we wouldn't want you to forego any kind of medical treatment in place of this, but it could be supportive. Yeah.
Okay, we will send out the replay, and let's see. I see your questions. I'm going to get to you. D. Morgan, link just goes to register. So here's the thing: if you, for anyone who has never bought from Microbiome Labs before, you usually have to go to a practitioner in order to order from them. It is a professional line. But through my special dispensation with the co-founder of the company, Kiran Krishnan, who's now doing other stuff and still educating the world about microbiome, we have the ability to have you order direct. So you have to register, and then it should be auto-populated with the account with SIBO SOS, and then use coupon code NOBLOAT15 at checkout to save 15%. This will also work for the vaginal and actually it's for the whole site. So if you want to get the test as well, you can do that. You look around the site, you'll find it. But very, very excited to be able to offer this to you with the education, with the discount. It's really a triple whammy. This is what they look like, just so you can just see live and in person. They're right here. Ta-da. And we have a ton of questions, but I also wanted to let you know that if today it's 2:33 Eastern time, for those of you who are watching this live, I did want to let you know that if you were to order, this is very important, listen carefully, anything from Microbiome Labs today before 6 p.m. Eastern, this is January 13th and we're live. So if you're watching this after 6 p.m. on January 13th, this little goodie's not going to be for you, but we're just thanking everyone for coming live. And even if not, you're still getting the 15%. So that's good. But if you order by 6 p.m. Eastern tonight, and you send us the proof of purchase, you have to do this part. And you have to send it to info@SIBOSOS, please, at SIBOSOS.com. We will share Alicia's slides with you as a bonus. So just I thought the slides were amazing. If you wanted a copy of them, it would be, we will give you a link if you email us and order by 6 p.m. Eastern time. So don't email me tomorrow or the next day. You get the idea. It's a heavy lift for my team. And we just launched the New Science and Wisdom of Menopause Summit today. So my gang is really working hard, but I did want to still offer this to you on the same day. And before we leave, I will give you the link to register for free for that summit, which Alicia is part of. And we have 70 presentations for you about women's health. And it is my Sistine Chapel. Okay. Carol saying, you tried the website, didn't auto-populate with my registration. When you registered again, it came up with a page that says you're already registered. Well, that is weird. Have you tried to place an order? Okay. Try to place an order and see how that goes. And maybe I'm saying things that don't make sense. But let me get you to some questions here while you sort that out, Carol, hopefully. Okay. We're going to have to go fairly fast in order to accommodate all of these questions. The link is just a few things up higher in the chat. You know what I'm going to do? I'm going to get a QR code for next time, and I'll be very fancy. I'll be very fancy. Okay. I have a condition now for over 30 years. I figured out it is the lichen. How do you say that?
Lichen planus, probably.
It's the SCHE.
Oh, sclerosis.
Is there an L in it? It's sclerosis. Well, anyway, you know, what is that?
Yeah. So some genital issues, right?
I think so. And no one knows how to test or treat it.
There's an autoimmune component to it. So I would say definitely looking at your gut health and working on gut health and doing all the autoimmune things to support. We don't have there's no scientific literature that we have on these strains necessarily specific to that, but you could say in theory, just in terms of, if there's inflammation, it could maybe help, but, we can't make any promises around that specifically, but I'd say you'd want to be looking at from an autoimmune perspective as well.
Okay. Menstrual underwear materials that absorb heavy bleeds, in what ways does that, or even adult diapers for that matter, affect vaginal microbiome?
Mm-hmm. Yeah. So that kind of goes with the hygiene practices. And this also is true for things like pads, tampons, anything that's going to have any of that type of material, anything, if you think about pads, it's also lots of moisture. And unless you're changing them really regularly, that can play a role. So those are going to affect the vaginal microbiome in a negative way. So if there's no other way around it, and you have to use those, then I would say you definitely want to be doing all of the hygiene practices as well as the supportive mechanisms for supporting your microbiome. If you are menstruating and you're in reproductive years, the menstrual cup is a great way to, I know this is kind of a side thing, but kind of along the same lines.
Let's solve some problems, people.
Yeah, but the menstrual cup is actually very helpful in helping to lessen the impact of like tampons and pads on the vaginal microbiome. So using like a menstrual cup, there's several out there now that you can use, but they can be very effective. They're easy to use once you get the hang of it. But it can be more protective for your vaginal flora.
I also heard there were concerns about like the applicators and microplastics for tampons.
Absolutely. Yeah.
There's some paper. Anyway, you're right. We'll keep going. Am I hearing you correctly that something like a partial hysterectomy could indirectly contribute to higher frequencies of BV, UTIs, yeast infections, and the rest?
Anything that is going to decrease your estrogen level, whether it be a hysterectomy, partial hysterectomy, menopause, postmenopause, pregnancy, the immediate post-pregnancy period when that estrogen level decreases, that all, yes, will influence the health of your vaginal microbiome.
What does the fishy smell technically due to? It's an imbalance of the bacteria.
Mm-hmm. It's an imbalance of the bacteria and some of the byproducts that they make.
What actions would result in no lactobacillus? I didn't think that was possible, even if one had dozens of courses of antibiotics in their life. Or is that exactly what causes it?
So lactobacilli are the first to go and the last to recover after antibiotics. So if you've had lots of antibiotics, lactobacilli can be affected. But yes, it's very possible to not have any lactobacilli in your vaginal flora.
About the translocation, a doctor told me that some women have a narrower distance between the openings of the vagina and where the anus is. And that just makes sense. Yeah. What sort of things must we mind throughout life if it's a narrower distance?
I think for that case, I would just be really cautious and really meticulous around your gut health, because gut health can definitely drive your vaginal health, and just doing all the things with supporting your microbiome and lowering inflammation, and food, whether that be food, nutraceuticals, hygiene practices.
And that hygiene practice, you always want to wipe front to back.
Mm-hmm.
If you go and get waxed, are they hygienic? Are you, HOCl is Briotech is a great thing to like spritz on the skin if you need it. After something like that, you don't want to have it to be a barren microbiota area either. But when the doctor says that to you, I don't want you to any way, shape, or form, if it is you, to feel abnormal, because it's not. We're talking about a couple of inches, right? Or like it's so.
You're talking
people's boobs are
probably not even inches. It's like centimeters.
Exactly. It's so microscopically like.
Yeah.
What was his point, or what was her point? Could you share your opinions on the use of boric acid and raw garlic and cheesecloth to prevent burning of the mucosa, kept in overnight, for example, to help balance things out?
Yeah, boric acid can also be very helpful for like yeast and vaginal imbalances. I just would be cautious in using it too often or too frequently, just because if done too much, it could start to disrupt that vaginal flora. But it can be used as a therapy for those things.
By the way, that fishy smell is a natural occurrence from the overgrowth or the imbalance, and they do use that to help diagnose the imbalance. I have to go tell someone that the male person is here. So, Sarah, those with histamine intolerance cannot take lactobacilli because they produce histamine. Is there a vaginal suppository? And can we use the capsules as a suppository? Sorry, guys. I'll be right back while you handle that.
Yes. Okay, so we aren't outright recommending that. However, how you or your practitioner decide to use the probiotics is up to your provider to decide how to use them. There is nothing in them that would necessarily be bad to put in the vet to use as a suppository. There's nothing to say that there would be an adverse issue. We just aren't. That would be an off-label use for us to make that recommendation.
Okay.
But how you and your provider choose to use it would be up to you.
Okay. There's also new toilet paper out there in the world. I'm just thinking about that kind of thing. There's a bamboo toilet paper. that is apparently fantastic. Alicia Silverstone from
Oh, Clueless.
Clueless did a very, very funny, very dirty R-rated commercial about it. So you may want to look into that if you find that some of the toilet papers and stuff are, being irritating to you or whatever. Are there repletions of the lactobacillus cumulative, or is it a supplementing indefinitely? Oh, sorry, daily for life because it's 24-hour correction with each day's supplementation?
So it takes about, for colonization of the lactobacilli to occur, it takes about a week to 2 weeks. Full colonization takes about a month to 4 months. So anywhere in that range. So we would recommend that you take the product for at least 3 months just to get that full benefit. Now, in terms of the establishment and the long-term gains, that's going to depend on your environment and also your dysbiosis risk factors and also your hormone levels. So,
yeah,
if you're in a situation like postmenopause, so there we go.
so
Yeah. If you're in a situation, menopause, postmenopause, you might need it as a daily to support, because if you don't have enough estrogen, you're not going to get that glycogen level to be high enough to really help with that establishment and colonization of the lactobacilli. So it might be an ongoing thing. If you're in your reproductive years, or if you just recently gave birth and your estrogen levels are recovering and you're supporting just during that time frame that your estrogen levels are low, but then you go right back to a healthy estrogen level, and you're also doing a lot of the things with your diet and you're practicing appropriate hygiene practices and all the different things that we talked about in terms of dysbiosis risk factors, then you might need it for just a shorter term course. So that would just depend on some of those environmental aspects.
You guys and gals, Lexi, Dottie, if you have anything that are questions, put them in the Q&A, please, because I want to make sure we get to you. Okay, the Astarte strains, were the percentages for pH change H2O2 produced, and the rest after 1 month, use 3 months, half a year, or longer? Also, if you can answer the same for any of the other study results with your products, with your presentation today. And also, did you include the links in those slides?
To the studies themselves?
Yeah.
No, but I could, if you'd like me to, I can send you the.
No, I'm just saying, could they go to PubMed and find them?
Oh, yeah, the citations are there. Yeah. Mm-hmm.
Okay, so you can go to PubMed and find more. Were the percentages for pH change?
Okay, so like the 58% reduction in.
I think so. Yeah.
Okay. I'm sorry, could you read the question?
Okay. And you can get to the Q&A box too.
Oh.
So the Astarte strains, were the percentages for pH change? I think they're saying, what were the percentages for the pH change H2O produced and the rest after 1 month's use, 3 months, half year, or longer? Also, if you can answer the same. So that's basically what the whole presentation was about. I don't know if I have your whole question right. I think there's like a word missing, so I don't totally understand the question. You can go to PubMed and look up some of the studies, and then you can also watch the replay if that helps.
Yeah, I'm not understanding that fully question.
So we're going to keep going. When women who are teenagers versus 20s or 30s versus older stages of life, how do the effects differ on average between these different age groups? So first of all, we know the estrogen levels are going to be different, right? Mm-hmm. Are there certain probiotics that prove more corrective or less corrective depending on the average age?
So I'll just say in the studies that were used with these strains, the age range was between 18 years of age, well, except for the pregnancy ones, obviously, but 18 years of age. And then they did include postmenopausal women. So there was I want to say up to 60-ish years old. And so these results that we're seeing with these outcomes did span these various age ranges. So I think I'm answering the question again. It's one of did I answer the question? I guess it's asking, do these certain probiotics affect different ages at different time, like different ways? Okay.
Hey, Magda, it's good to have you here. I'm 85, she's saying. Well, so basically your estrogen would be very, very low.
Yeah.
Okay. Like when you go in menopause, your estrogen level goes typically to that of like an 8-year-old girl.
Right.
So you should definitely, if you're interested in doing this, you should act accordingly based on that. Mm-hmm. Where like every day maybe would be right for you. So there you go.
Yeah.
Okay, we had an addition to, I'm asking about the percentage changes. Was that after 1 month? Thank you. Were the percentage changes after the 1 month of supplementation used by the participants in the study? Or was it after the 3 months of supplementation that resulted in those studies? It changes.
It was at the end of the, so it was at the, so for a start date, it was actually after just 1 week that they did that they looked at the changes. And then in the Candida study, that was 6 months. So these results were at the end of whatever the study. So if you get the slides, what you can see is that there's a study dose range of the time frame that they were doing the intervention, and then the results were at the end of that intervention. So it can range anywhere from a week, 6 months, 1 month, 2 weeks. So you can get some good results in a pretty relative short amount of time.
Okay, are the probiotics technically created in a lab with foods or lab made synthetically?
So they are all human derived. All of these are human derived, but there has to be some laboratory. They basically help with, and I don't know all the intricacies of this, but essentially they help with the originating strain, and then they, through laboratory measures, they duplicate that strain. So it's all going to be human derived. There's not any like food processing that goes into this. They're all of the Astartes strains are human derived. Isolus is human derived. LGG is human derived, and then the LA5 is human derived.
Okay. Am I correct in understanding that adding in probiotics when facing certain vaginal and reproductive conditions can be brought into balance without adding antibiotics and measures that would kill off the biome? That's what she's saying. With which of these vaginal repro conditions would you think it wise or more so necessary to do a dual approach of adding probiotics and killing things off, or just killing without the probiotics? So just to be clear, that's a very specific medical question that is going to vary based on everybody's own snowflake microbiome.
Yeah.
So I just feel like I'm setting you up for not really being able to answer the question. I get what you're saying, but it's like a huge, huge question, and we don't have time. And even if we did have time, I don't know if we could ever answer.
And honestly, and we're not saying that you should ever take these probiotics in lieu of medical advice or in lieu of a medical intervention. Because like if you have a UTI and you're an older woman, or if you have a certain situation where antibiotics are really needed or antifungal prescriptions are needed, you need to heed the advice of your medical provider. What these can be is an adjunctive therapy, if that is the choice that you and your provider have decided that it is appropriate for you to do medical intervention. You need to follow your doctor's advice. This can be adjunctive, this can be supportive, and it can be helpful for potentially rebalancing some of the reasons for why that came about in the first place. But it would not take the place of your prescriptive therapy.
Okay, in a minute, I think we're gonna be able to pull off, if we keep going really fast, everybody's questions. But listen, I'm gonna post the link to the New Science and Wisdom of Menopause Summit, which we just released to the public today for registration. It doesn't happen until February 24th. That'll be for free, but if you want to buy it, it's like $89 or something, and it is phenomenal. But I say that because I know there are 50 master classes on there, and I know what's in there, and I know how special it is. But if you have a chronic UTI, because Magda, Dottie, you're both asking about UTIs. UTIs can kill you. Okay. There was a recent Hollywood actress who died of a UTI recently. So that is super, super important that you get that under control. And there is a lab called Microbiome DX. Put it in the chat right there for you. And there is Live UTI Free. That is a website that Ruth K-R-I-Z, who is a nurse. I think she's got other credentials too. I can't remember, but her whole passion has been chronic UTIs. And the testing that she has sort of developed from Microbiome DXs, which is the lab, is very, very special. She has 2 master classes about it in the summit. But people usually will go to the gyno, go to the urologist if it's more serious, and they will culture for E. coli and a few other things. When the studies came through more seriously and more rabbit hole, they found that E. coli was only a very small portion of what was causing real UTI, chronic UTIs and interstitial cystitis. So please, please, please dig into that, because that can totally change your life. Okay. And also perhaps even save your life. So that's one thing. The other thing is, did you all see Halle Berry talk about how she thought she had herpes because she had so many lesions and tears of her vaginal walls? Her doctor thought it was herpes. Turns out she was in menopause and did not have enough lubrication after having relations with her partner. So she's now on, like I am, like telling everybody about it. So if you have, so somebody's got some lesions going on, and it could be from that, and if it's not from that, you definitely need to get tested. And I believe that MicroGenDX also has some more in-depth testing that you would want to dive in. I got to get back to the Q&A box though. So here we go. With Hydrine, what is the recommended soaping practice when taking a shower? Can I use a couple drops of Dr. Bronner's? Do not use the eucalyptus or the mint, or you will be very, very unhappy. Dr. Bronner's essential oil while I shower and apply to the nether regions while the shower is running. And what about cleaning up after sex? Well, definitely pee after sex. Okay. Definitely pee. Some people I've heard say, oh, it doesn't matter. You know what? It just makes sense to go pee. It just makes sense.
Yeah.
Okay, go.
Unscented. Use unscented.
Yeah.
Soap. No scents. Definitely pee after, if you're using any toys, make sure that you're sanitizing and cleaning those as well, especially if you are in female-female relationships. One of the things that happens a lot with, a woman who's in a female-female relationship and the vaginal microbiome dysbiosis is the use of toys. And so just be mindful of that. I'd say those are some of the big ones. Change out of your sweaty workout clothes. Don't stay in your yoga pants after hot yoga for hours. Wear cloth underwear. Don't stay in yoga pants all day. You don't want to stay with that spandex and all those.
You got to get breathe. You got to get air motion.
Air, dry air, clean air. Yeah. So, I mean, those are just some kind of hygiene practices off the top of the head.
Yeah. Also, could you share your opinion about pros and cons of placing in yogurts or common foods inside the vagina? Oh, that's a lot of bacteria, people.
Yeah, I don't know that I would. So like yogurt douching. I don't know that I would necessarily recommend that. That could get a little, I don't know. You can you can do a lot orally too. And there are some, I don't know that I would do that necessarily.
It's like you don't want to be like paranoid, right? But you also want to keep it clean and balanced. With C-sections, are there certain probiotic protocols you could name or that your Microbiome Labs offers that would help get the child's microbiome as close to what it would have been with a natural vaginal birth? Great question. They're all great questions.
Yeah. I mean, you can do some OBGs, and you could talk to your OBG, or if you are OBG, or, talk to colleagues, but so what some will do is, if there's a C-section, is they'll do a vaginal swab of the mom, and then they'll inoculate the baby. So they'll kind of take what the baby would have gotten, and it won't be exactly the same, but it's going to get you some of that colonization of those good vaginal microbes into the baby. So they'll swab, and then they'll put it all over the baby and in the baby's mouth, so the baby starts to get colonized.
In the chat, I just put a very ugly link, but that is the registration link for the New Science and Wisdom of Menopause Summit. Let me know if it works. What happens if taking the pregnancy support before the 33 weeks, like in the first few months?
Yeah, I mean, we say 33 weeks because that's the study, but there's nothing in there that would necessarily be unsafe for prior to that. So, I mean, I'm cautious. I'm more conservative about not doing anything too different in that first trimester, but I'd say starting, second trimester, you could definitely start.
Talk to your doctors for sure, and your midwives. You mentioned lubricants. What lubes are good or bad for use during sex? You want it to be clean. You want it to be clean, clean, clean. And there's what is that company called? No, I mean, they're advertising like crazy now, right? Like, it's clean.
Yeah. I don't know. Yeah. Yeah. I can't off the top of my head think of which, yeah, I'd have to look.
Let me just say that there used to be like none, and now there are a lot.
Yeah, there's
Which
plenty.
there's a lot. But definitely go down that rabbit hole, like, and make sure that.
And don't use coconut oil.
So coconut oil can be an issue, like typical massage, like spend some time researching this so that something that is supposed to be lovely is not a nightmare. Dottie has used Alo Cadabra, and it's awesome for many years. Go Dottie. Okay. My girlfriend has almost a dozen UTIs annually. Boo. Which one or one should she consider buying from you? And is it a near guarantee to stop this pattern? Absolutely cannot say if there's a near guarantee. We love you and we've wanted to go away for sure, but we could never say that because who knows why that is happening, but definitely something for you to investigate. Are there adjunct therapies that need to be entertained? Absolutely. And I would definitely get her tested at Microgen DX. What's cool about Microgen DX is you do not need to have a doctor. To the best of my knowledge, call them. They're very friendly. They're very communicative. And tell them I don't have a doctor to do a prescription at this time, or maybe you do, and talk to them about how to get it. Okay. I know ozone gas is used to fix a number of vaginal problems. Does ozone kill off the good bacteria as well? Thoughts on ozone? I'm a huge fan. What do you think?
Yeah, I think ozone could. I mean, ozone therapy is very helpful. I'd have to look to see in terms of specifically, percentages of microbes and which microbes would be more susceptible to it. But I know it can be very therapeutic for a lot of people.
And broken record in the summit, we have Tobias Siegel doing a whole hour presentation on women's health and ozone, which was phenomenal. It's great for UTIs. I'm so glad someone brought that up. They also have ozone suppositories. Also, I cannot pronounce the name of this disease. It's a penis problem. Peyronie's. It has to do with scar tissue in the penis. And they are doing a lot of ozone therapy for that disease. And I had him mention it because I think we need really a summit on men's health. I'm probably not going to take that on, but that would be great. Because there's not a lot of discussion about men's health, at least not in my circles. There might be somewhere else, and I hope there are. But there are ozone treatments for it that have been phenomenal. Like people aren't having to get surgery. Everyone's results will vary, etc. How these probiotics should be combined with spore probiotics? I heard that megaspore are the only ones that survive gastric acid. How do these target vaginal issues if probiotics are digested? Do you also have products to take after antibiotics for teenagers?
Okay,
multifaceted question.
Real quick. So on the lactobacilli, so there's human-derived lactobacilli, there's dairy-derived lactobacilli. Lactobacilli that are human-derived have a special enzyme in them that help to keep and maintain the proper pH within the cell. They have it's a enzyme that helps to pump out protons or hydrogen, which is what regulates pH and acidity. So as these lactobacilli are going through and they get to the stomach and it's a very acidic environment, that flips on the switch for this enzyme to activate. That enzyme starts to dump out protons. So it helps to keep the internal cellular pH to still be at that proper pH for the cell to function. And it does that until it gets to a more neutral or more alkaline pH, and then the enzyme flips off. So it's like a boat of, like, I envision, like, was it 3 men in a boat, and they're like dumping out the water so the boat doesn't sink. That's what this enzyme is doing to help keep the survivability of these lactobacilli through the digestive tract, and to get where it needs to go. That's not the case with all lactobacilli. So just wanted to answer that one little piece of how it survives.
And ozone is toxic in certain situations, but not in others. So go to the Menopause Summit and watch his presentation because he explains that. And I am a fan of ozone, let me just say. I wish I'd had it all my life as a first aid kit. Okay, let's see. Did you cover that entire question?
Oh, what was the other part of the question? So
do you also have products to take after antibiotics for teenagers?
Restore Flora.
Restore Flora. That is also a Microbiome Labs product. Denise, my daughter's doctor told me that she has high lactobacillus causing delactate and not to take it. Have you heard of this?
Yes, it's called cytolytic vaginitis, and it's when someone has an overproduction of lactobacilli. Usually treatments for that are like baking soda sitz baths, hygiene practices, not using the scented soaps. So that would be a case where you probably wouldn't want to take the vaginal balance product. But that's a diagnosis that you have to have a medical, like a pelvic exam. There has to be like a true medical investigative process that goes into seeing if you actually have that or if your symptoms are caused by something else. So that's a case where you'd want to test.
Okay. Douching do's and don'ts. My herbal person has recommended sitz baths for me when I ran into problems down there, and I don't know if there are any negatives.
Sitz baths are, yeah, usually great for, it just depends on what you're putting in the sitz baths.
Right. And like, are you doing, maybe she suggested, or maybe you could think about like a yoni steaming, which is, so I went and I did this once, and it was a crock pot with herbs in it. And then it was this box inverted, it was wooden. And then they like basically put for lack of a better term, like a toilet seat on it. But it was a towel. Actually, she just took a towel. The box upside down was wooden, had a hole in it. It was quite primitive and darling. And then she just like wrapped a towel like you would wrap, like if you were Rocky and you had the towel wrapped around your neck, just plopped it on top of the wooden box. Cause I'd heard a lot about it. And I mean, if I had a problem at that time, I didn't have a problem at the time. It was just like an experience, but I could see how that could help. That steam gets up in there. Okay. And what?
It's therapeutic for sure.
For sure. And also, like, this is an ancient healing technique that people have used for a long time. Yeah. With PMDD, I don't know what that is, where menses are an absolute hellish experience. Is that beyond probiotic to go about supporting? Can I take anything else for this? What is that?
Yeah, I mean, PMDD, that's premenstrual depressive disorder. There's a lot that goes into that. There's hormone shifts, there's some vaginal health involvement. That's a bigger diagnosis that you need to look at all kinds of look at it from all different angles.
What is the accuracy of using pH strips inside the vagina or urine, etc., to get a super general sense of the overall vaginal environment? Kind of like a pulse oximeter at home to have a general understanding.
Yeah, you can use pH strips. There's several on the market. You just want to just get some that are easy to read. There's several that you can get. But yeah, it's a great way to just get a kind of a first pass check to see, is your pH range between that 4 to 4.5, or is it much more acidic, or is it much more alkaline?
Okay. Listen, guys, do you have like 5 more minutes, Alicia?
Yeah, I could probably stand.
Okay. So should these be combined with Megaspore?
They can be, yes.
Okay. MCT oil as a lubricant not advised, like coconut oil. I've heard mixed. What do you said no? So
I'd probably just not do that, but
there are a lot of other options, guys and gals. Yeah. Is diet important during the types of fats we eat, and what about stress?
Yes.
Yes. Just yes. That will change your pH. That will absolutely change your pH. Are all menstrual cups the same? No. Are some better and more hygienic than others? You really probably going to have to experiment. Heard bad things can happen with repeat uses. You got to clean it well, obviously, and not sure if dousing it in alcohol. No, it is the only way to ensure not giving entry to something that will cause something. What do you clean yours with? If I ask a personal question.
Yeah, I mean, the menstrual cup company that you go through, they're going to give you the appropriate ways to care for that particular menstrual cup. So there's different ones, there's different ways, but yeah, you have to follow the hygiene practices that are outlined in that company. I will say the risk is low as long as you're following that. There really is no safety issues. They're very safe to use. You just have to clean them and clean them at the appropriate frequency.
So there is something called HOCl, which I can't pronounce, the hydrochloric blah, blah, blah. But Briotech is the brand that I use to clean things non-toxically. It kills COVID. It kills so many things. Go down that little rabbit hole and find out about that often. Clean makeup brushes in it, the whole bit. So that might be something for you. I have to stop with the questions, guys, because we're running out of time. But I want to give you something about the UTIs. There's talk of seeding of the probiotic that it can anchor or multiply. That is a myth. is that where these probiotics can do if you take them orally? Meaning there was a myth for a while that spore probiotics like will take over
Oh, no.
life.
Mm-mm.
That does not happen.
Mm-mm.
And are there expected differences if we open the capsules and pour them straight in vaginally?
Is there a risk if you open the capsules and put them in vaginally
Are there expected differences?
in outcomes of how?
No. Yeah.
We don't really know because I mean, we don't know based on the science because it hasn't been done. But just general probiotic suppositories have you can do that safely and have good outcomes, especially with things like IVF and all these different vaginal, helping to correct the vaginal microbiome. So vaginal suppositories, probiotics are fine usually.
Would you ever open and pour vaginal probiotics internally with a carrier oil? Which oil applied in on and around the vagina would do the least in killing a good bacteria, and which oils would kill the good bacteria? Coconut, castor oils.
So actually, if you just open the capsule of the probiotic and just insert it, that's all you have to do. You don't have to do it with a carrier oil.
Okay. Say that again? You open the capsule
Mm-hmm.
and then like just keep half of it
Mm-hmm.
and insert half of it. Right.
Mm-hmm.
Okay. How to optimize the body's utilization of the probiotics, certain foods, drinks, and or other things to pair with it.
So in the studies, not all the studies explained exactly how they took it. I know one of them said that they took it like 30 minutes before a meal. So you could just do it kind of around meal time. So as long as you're doing it around food. Probiotics in general, and we say this with spores, the survivability is actually better when you do it with or around food. So we would just recommend that you take it with or around food.
Here is the new Science and Wisdom of Menopause Summit. And these are all pictures of my friends. So see this woman over here with the thumbs up, and she's got a big barbell in front of her. That's Ruth Chris. That's who I've been talking about with Microgen DX. She is a badass. So there are my two older sisters. There's me with kitty cats. So I started to do this, and I had all this clip art and all this stock photos. And then I started thinking about my friends. I'm like, I'm putting my friends here. They're amazing, and they're living their best lives. So anyway, these are all menopausal women, but I wanted to show you. There's Dr. Keisha Ewers. Here are some of the other powerhouse speakers. Here, day one. I'm just going to very quickly go through here, you guys and gals. Day two, there's Ruth again, right there in the middle on the top row. And then day three, there's my other sister on the bottom of that row. I'm looking for you, Alicia. I can't remember what day you're on. These people are amazing. There you are, top row. Day 6, women's health, fertility, menopause, and beyond. So these are some very, very special speakers. This is a super huge event. There are 70 presentations. Please join us for that. And thanks to Microbiome Labs for being one of the sponsors for the event. It was very helpful. And also, Alicia, you've done a beautiful job yet again. So thank you so much. You're a genius and a scholar. Mwah.
Oh, I'm happy to do it. Love talking to you guys. So
we love having you. So we'll see you next time, and thank you.
sounds great. Thanks.
Okay. Thank you. Bye. I'm just going to stay on and remind everybody that if you make that purchase for something from Microbiome Labs by 6 p.m. Eastern tonight, that we will send you a link. You have to send us the proof of purchase to info@SIBO.com. And you send us the proof of purchase by 6. We'll send you the link shortly thereafter, and then you can see our slides. But everyone will get a chance to see the replay no matter what. But that's just like a little extra. Does the Biome FX tell you exactly what to do, or must a practitioner decipher complicated results and give you a 10-point plan? I'm going to say that something in between. It depends on here's the perfect answer. It depends on your results. I did it, and I took my little test to my gynecologist, and she's like, oh, that's interesting. Let's test, because I've got this swab right here. And she tested and confirmed, which confirmed that, what I walked in with was right. So, but mine was not complicated. Thank you. Thank you, universe and God. Mine was not complicated at the time. So it depends on how complicated it is. I think that's really the best way to answer that. Dottie, your talks are always enlightening. I saw your facial reaction to the castor oil. Some ladies in their 70s are using it to moisten down their yikes. Please forgive me for making a facial expression about castor oil. I have heard mixed reviews about MCT oil. I've heard great things about castor oil. That's what I've heard. So that's it. And my friend is the Queen of Thrones, our lovely Dr. Marisol Tiero. She loves it for that. Like she was going on about how much she loved castor oil as a lube. God bless her. So if that works for you, great. But please make sure it's like from her, that it's, organic, cold pressed, really, really very clean, that you're not just getting like a wannabe. There's been a lot of counterfeits in the market these days. And so that's probably what you were seeing in my face. I was like, oh, just make sure you get the right kind. And chances are you probably have to use a lot if it works for you and you've not had any problems. But on the other hand, if you have had chronic UTIs, whoever, look there, you have to be your own health detective, right? But Microgen DX, I know I'm throwing a lot of information to you guys today. Microgen DX, I believe, is saving people's lives. And the reason I'm telling you this story is because a good friend of mine, she's older, in her late 70s, she was having chronic UTIs. She went to the normal doctor, many times the gynecologist. It's cultured. Nope. Here, try this antibiotic. Try this antibiotic. Not working. We went to the urologist. Urologist did a culture, which is more than the gynecologist could do, right? They test for other things. Nope. Couldn't figure it out. Here, try yet another antibiotic. We'll just throw something at it. Nope. On the counter at the urologist's office, they had a brochure from Microgen DX. And I thought, oh, someone here has got their act together. I'm going to let this play out because maybe it is something covered by insurance that she can, get taken care of very quickly. And as I told you, it didn't work. And Ann Hill, the Dr. Ann Hill, the amazing naturopath who's a friend of mine, had told me about Microgen DX a couple of years beforehand, and Ruth Chris. And so I called the doctor on my friend's behalf. I was like, hey, can we get Microgen DX? She goes, oh, yeah, we didn't mention it to you because insurance doesn't cover it. Well, I think some insurance may cover it. It depends. It does. Some insurance does cover it. And Medicare may even cover it. However, at that point, spending about $200 to $300, which is not chump change, don't get me wrong, to see my friend suffering now for months with an insidious UTI, which, as we all know, if you've ever had one, is hell on earth. Yeah, here's my money, take it, help us. Well, that happened, right? We got the test results. And lo and behold, they figured out what the frickin' bacteria was. And lo and behold, a different antibiotic, and she got better. So, sorry. Is this being recorded? So please listen to these practitioners, check out the summit. You're going to see so much of this kind of information that is not common knowledge. That's the thing. Why do I do this work? Man, I'm on a soapbox today because I want to have conversations with people that help solve their problems that are not happening in the typical doctor's visit. That's why I do it. So whether it's biological dentistry, your liver, your gallbladder, your microbiome, your vaginal microbiome, your menopause, your biological dentistry, did I already say that? That's why I do this. So I hope you will have a beautiful, healthy day. I thank you so much for listening. I thank you so much for being here. And I applaud you for advocating for yourself and becoming empowered through knowledge and wisdom. So next, action is up to you. I do think that this is a phenomenal set of discoveries and developments. So congratulations. I'm very, very happy about this. Woo! Ooh, gene site therapy. If you want to see what psych meds make it, may or may not work, so worth it. Is it gene site? Is that what it's called, Dottie? I know exactly what you're talking about. I thought it was called something else. I thought it was, this is exactly what I'm talking about. I thought it was called Genomind. Let me just look that up and then I'll let you know. Genomind, is that what it's called? That doesn't sound like yeah. Home Genomind. Is that what it's called? Look at this. Is that what it is? Checking, Dottie. Okay, thanks. You're welcome, Donna. Thank you for being here. I like the way you spell your name. I'm just going to show this to you. I have so many stories. delivering target and personalized care. Genome brings critical prescribing data into one integrated platform so you can easily managing medications for individuals. This isn't it. This isn't it. This is interesting, but this isn't it. What is it? Checking. It's something like that. And it will check your DNA to see if the antidepressants will work for you or not. Does GeneSight, okay, maybe that is it. Sorry if I thought it was wrong. I'll look it up too. Where can we find the enlightened OBGYN practitioners? Well, look on the summit because there are a bunch there. Oh my gosh, so special. A couple of naturopathic OBGYNs I've been to have proven underwhelming in how natural they truly are with their approaches. Directories. I don't know of a directory, but I'll keep my eye out for that. Does the new summit have Q&As? I'm so glad you asked. They do. I was like, do I want to do that? I'm like, yes, I do. Every single day of the live summit at 3 p.m. Eastern time, February 24th through March 3rd, I will be bringing in some guests. Honestly, this has been a very heavy lift for me. This has been a huge, huge project. I haven't secured everybody. I do have Sharon Stills booked for a day after March 3rd. I can't remember the date, but I am working on that. So I'll keep you posted. I literally, if you read the emails, it says we're having them, but I don't have the people booked in yet. It's been crazy. Okay, because my tech had a problem and it happened over Christmas break, and thank God we fixed it, but gave me the chills. There's a lot of really special people on this event. Dr. Stills is amazing. She's a naturopath, but really does love women's health. She's done other menopause summits, and we were like, well, I'll support yours. You support mine. Okay. I'm going to go to GeneSight. I had my husband actually do this, and GeneSight test for psychiatric and depression medicines. Dottie, I stand corrected. I was getting like 3 words all confused in these titles and names. Let me show it to you all for those of you who are still here. This is amazing. So my husband, who I don't think he'd mind me telling you, has ADHD. And as a younger man, he was given Adderall, a specific kind. He was also given something else. So fast forward all these years when we did the GeneSight test, that is it. And lo and behold, all the attempts to get the OCD and the ADHD taken care of, not the right meds. That's right, people, wrong meds, because they were guessing, doing the best they could with what information they had at the time, but they were just doing, well, this is what we usually do. Let's try it. And so best of intentions, we got the science tracked to see how his genetics were lining up with those medications. Totally improved. He wasn't suffering that much, so it wasn't like life or death. It wasn't like disaster. We're very lucky and blessed. And then we just felt like, okay, this is really great science. It's really helping a lot of people. So we're really excited about that. So I don't have a summit lined up for GeneSight. I should probably find someone who is an expert in that and do a masterclass, because I think that is fascinating and so many people need this information. But this is the type of stuff I love talking about. And Dottie, thanks for reminding me. Right. Chris is saying, oh, I did that test and cannot take antidepressants. Okay. I reviewed the results with Doc today and tell you what, we now know why after 30 years, nothing worked. Yes, an ADHD, not depression, anxiety, but it does happen as a result. Yes, I have ADHD and that was why. I'm with you. That is amazing information. That is fantastic. Just want to tell you one other thing about that. Okay. If you cannot take antidepressant, Chris, I want to tell you about something. Go look at Fisher Wallace. How do you spell it? Fisher Wallace. Go look up Fisher Wallace. They have a headband that is I don't know. So I'm going to tell you a long story short. I got a thing on LinkedIn from my sister's friend, Chip Fisher. Chip Fisher is the co-founder of Fisher Wallace. My sister went to elementary school with Chip. And he's like, grown up man. My sister's grown up person. And this is 50, 60 years later. And I just know him from my sister. I don't even know him well. Like if he came into this room, I'd be like, hey, who are you? He'd be like, Chip Fisher. I'm like, hey, Chip. I wouldn't recognize him, but he's a lovely person. And he had PTSD. And I think maybe his partner did too, the Wallace part of this. And they have been inventing a device to help with depression, PTSD, and a variety of other things. And it is a headband and it's super cool. And I don't know when it's coming out to the public, but I think like if you invest a little bit of money in it, they'll send you one, something like that. So just look into that because it is a drug-free alternative for depression that is being used with veterans. Wow, I also have extreme PTSD. Just looked it up. It says $14. I don't know. I don't know what that part means, but it's been used very, very successfully with veterans who have PTSD. If I say anything else, I'm going to tell you more than I know. So just, it's a replay. Yeah, it's not $14. I wish it was. It's not $14. But with that being said, I hope that you gleaned some information you didn't know before by coming today. I hope that if you do decide to place an order, you send us the proof of purchase by 6 p.m. Eastern time. Well, you will get a replay later on tonight. I thank you so much for your time and attention, which I know is a very, very high currency. And I truly value you and thank you. And I will see you next time. Okay. Mwah. Yeah, vagus nerve, that's good. That is very, very good. But check into what this technology is because I think it goes beyond the vagus nerve. The other thing I would look at is pain-free for life. It is the Avisia device. It's Rob Van Bergen, and it's this little device that looks like a transistor radio from days gone by. And that I know has had some interest. It's a pain device, but it also does a lot of other things, and it is a specific microcurrent therapy. So look at those two things. But I would definitely look at the Fisher-Wallace because that is specifically for PTSD and depression. Okay. Love you guys. Thank you so much. Oh, I got 4 questions in here. I think we already got that. Does the new summit have Q&As? Yep, I got y'all. Okay. Peace out. Talk to you next time. Thanks. Bye.